I was there when I needed someone who wasn't getting over you. When I move to the side, when I move, call you mine, and I know what you're feeling. I'ma take you for a ride, let me take it off your mind, cause you know it's a season. And I move, and I move, and I move when I ride, and I move, and I move.
Guys, so this morning I washed up, I got new clothes, feeling great with myself. Now, this morning is really early in the morning, so I'm just out here drinking some water. I gotta go refill. So I gotta go fill me some more water. So in today's video, it's just going to be a get it all done with me. Let me go over my schedule so you guys can see what my day is constantly like. So you will see me in this same shirt for the next 10 videos at least. It's because I'm trying to so I start school back on the 7th. So this break actually helped me be able to focus just on my business alone and personal life. But now that my school is, I'm slowly purchasing. It's a slowly purchase. Oh my God, why I keep saying purchase? Slowly approaching. I need to prepare myself. I have the book that I will be writing in for school. I have to make some bath bombs. I have to make some face masks I need to test out because, as you guys know, I am making a self-care kit that will consist of having bath bombs, lip oil, lip scrubs, like a little spatula, and also a little tool that you can use to scrub your lips. You will get face masks. I'm also putting in eye mask, lip mask. We got some lip oils in there. I'm also thinking of adding something else like a bonnet maybe. I don't know. It depends on how I feel. But this self-care kit will come with a lot of good stuff, some little goodies that you guys can enjoy. So
she was apparently crossing the street and she got hit by a car from what I'm guessing the right-hand side because all of her injuries are on the right. Do not move your neck. Do not move your neck. We're just going to feel in the back here, okay? Okay. All of this hurts. Okay, let's get her forward more.
So I'm watching TV. So let's start. So I'm gonna face you guys down. We're going to get this stuff right. I also need to do some language. Like I told you, I'm learning Spanish. So I want to do that as well as what else? So I want to do some bath bombs today. So like I said, face mask. I want to print out my labels for my hair growth oil, lip oil, and lip scrubs. I want to.
The X-ray of your hip looks okay. All right. Your wrist.
What else? It's on the tip of my tongue. I still need to search for products for my school because, like I said, I got hiccups. I'm sorry. I need a few more products. So I need to do that. I also need to go refill my water bottle to drink out some water throughout the day. I feel like I'm coming back on juices, pops, and stuff like that. So I've been drinking water. Like I'm not gonna lie, I had juice pop there, but not as often as I usually have them. I've been drinking water more often, which is good for my body. And yeah, so I'm gonna go refill this back up with some more water, and I'm gonna be back. I'm gonna set you guys up so that way you can see me work. I have a lot of work to do, so I want to set you guys up so you can see me do it. So I'm gonna pause you real quick so I go run and go grab me some water, and by the time I get back you will be already set up and I'll be laying down on the floor. Yes, I like to work on the floor. I don't know about y'all, but I don't know. I just feel like I'm more productive on the floor. Okay, I got an A in school. Okay, on my assignments for working on the floor. So I want to continue to work on the floor because that's what's best for me and it helps me. So let's do this. I'm looking for my other phone.
Very low, and we're in the process of fixing that now. And his blood pressure is responding very nicely. He's at 160 right now, which is a very good blood pressure.
I found it.
What's going on here? His pulse rate just jumped. His heart rate should be fast because he's sick, but it seemed to go up very suddenly all of a sudden. So
Raphael's erratic heart rate can indicate more serious problems. They can't wait any longer for the X-rays.
You gonna book the CAT scan with him? Do me right, man. Make me proud. I put a lot of work into this guy.
His wife Carol arrives with other family members.
He's definitely not out of the woods, but he's looking better now than he was when he came in, definitely.
Thank you very much.
No problem. I wish I had better news for you. He's gonna be in good hands up there, okay? You're welcome.
But during the scan, Raphael's condition plummets further.
I'm getting into the unit. Forget about it. We're gonna go to the unit. Normal blood pressure is 120 over 80. He's 80 over 50. So I really don't think right now waiting to get a CAT scan in his abdomen is so critical. Okay, but let's get him to ICU to get him a little bit more stabilized, get a better reading of his blood pressure.
So he's in the intensive care unit now, and they're going to try to get him stabilized, and then if they can...
All right, so here we go.
Yeah. He's on antibiotics, and...
Basically, they have to make a small...
Okay, I'm back. I feel
But right
my
now, he's
water.
doing okay. I spoke with the ICU attending, Dr. Adler. He's making a bed for him in the ICU, and our neurosurgeon, Dr. Coe, is being contacted while we speak.
Juan must stay in intensive care in case his condition
So.
worsens.
I do want to start looking back for kids' clothes. Like I said, I want to be that one-stop shop. So I want to sell kids, men's, and plus size women's clothing. I already have the women's clothing down pat. It's just the kids' clothing that I'm looking
Another
for.
assault victim is being
So.
treated. Anthony Gary is the sixth one this shift.
What's your name?
I'm even thinking about adding shoes, kid shoes. So we'll see. As for right now, I do have like some kid clothes vendors right here. These are just some kids clothes vendors, and if you want me to go into this list, I would go into it.
Marks on his head.
So
He
yeah.
was kicked with some force.
I still want to look up.
We just want to make sure that he doesn't have any like injuries within the brain and also.
I still want to look up
so far,
some more,
looking
so,
good.
some face masks. Can't talk recipes. I don't know why I can't talk today.
And, you know, they go home
So.
with some-
But there
This
was
is
a
for my
recent
shoes.
death that was
Yeah, I have to finish wearing my shoes down.
The good news is that the fracture is very, very...
These
very
my
slight.
tracking numbers
Line fracture.
for my other stuff that's coming in.
Hence, inside of which trauma is.
So, let's start. Okay. Well, let's start, you guys.
Back in minor surgery, Olson's handiwork on Carmen's eye is almost complete.
How you doing, all right? You're not in any pain, are you? So the part that's torn open is actually very nicely torn open, and it's very easy to close. The part where the shoe hit is bruised, and there's a lot of kind of skin missing, which is definitely going to have a scar.
So-
No matter how good we close it.
I'm gonna look for
Personally, I think
that
it's
on.
wonderful.
So it's always good to know the kid sizes that you're trying to look for. So I know my kid sizes. I wrote them down. I just got to find where I wrote them at. I think I wrote them.
Man, I do good work, I gotta say. I hate to toot my own horn. I don't know. So, oh, don't touch it, please. I gotta tell you, it looks good.
Yep, here you
There's
go.
no reason to be upset.
So, I
okay?
finally run that, so let me rewrite them here. There's no more room over here.
The whole night? Okay. You'll do okay. These things happen. I'm telling you, though, we did a very, very nice job closing it. Okay? That's my job. That was a particularly complex one, and it was pretty time-consuming, but, you know, I enjoy it. And she really appreciated it, and she seemed like a very nice person. So I'm glad that we did the best job we could do for her.
Of course, this is my best friend. I'm ready to start to pay for it, okay? Thank you. Thank you, Cindy.
a.m. Never thought this was ever
So,
going to come.
this is the size
One chest tube, 2 intubations,
here.
good laceration in the arm. The night went by very quickly, though. I mean, I'm totally energized and wide awake, although I know as soon as I see the car and stuff like that, I'm going to get really tired. Sleep
It's my nose.
for another night.
Excuse me. Don't tickle my nose. I didn't really do that.
The infection in Raphael Colon's leg didn't respond to treatment. He died the next day.
Oh no,
And
my
Ada
God.
Cruz, she was discharged from hospital 1 week later.
Okay.
Breathe that New York City fresh air.
New York City, the South Bronx. These are the real men's streets. This is St. Barnabas Hospital. The world-leading trauma center, witnessing firsthand the harsh reality.
Caesar, come back to me, buddy. Come on.
2 children pulled from the rubble of a collapsed building.
All nerves are cut. All sensation is lost. Things don't look too well.
A young girl with a gruesome complaint.
Now without beaten by the stuff.
New York City, the South Bronx.
Okay, so
These are the real men's streets. This
object is to get our boy clothes and girls clothes. We'll look for the boy clothes first because I do have 2 male models with my
witnessing
nephews.
firsthand the harsh reality.
Caesar, come back to me, buddy. Come on.
2
I'm
children.
gonna go
pulled from the rubble
ahead
of a
and
collapsed
try Alibaba because Alibaba is the best where all the vendors are at.
building.
So it's up to you to figure out which vendor you want to work with. I like to do verified vendors that have a 95 and up % on time rate, as well as 2 to 3 hours, roughly, even 1 hour, roughly response rate. Look, because and honestly, that's a long time. Well, they are in China, so you gotta think about that. So, I roughly want to try to find one vendor that has boy and girls clothing. Why I keep
There's
moving?
2 children coming. We got a report that there was a collapsed building in the neighborhood.
I have my sizes here, and what I have plus shipping, and then the whole total will go right here.
What they look like.
The news gets worse.
What's coming?
So,
Adults? Alright. From the same collapsed building?
So
now we have another adult coming in as well. So we're going to get multiple beds set up now because this is technically a disaster. Alright?
Dr. Edith Zabel takes charge as the trauma unit goes on high alert.
Listen, first pediatric case in this bed, second pediatric case in this bed, adult in that bed, and then we'll start rotating again, alright?
Zabel can't handle the flood of victims on her own. She calls for backup.
Pediatric or adult? Pediatric straight in the back. Alright, ours is pediatrics. Come on. What happened?
So,
What's his name?
David Wilson.
Hey, David. How you doing? A lot of stuff happened to you this morning, huh? Listen, we're gonna put you on.
like I said, I like to do those who want to go ahead and grab the phone.
Rescue workers pull 10
Okay.
Road up from below.
This right here is my pencil box. This right here are my 2 things. How I make my bracelets. Right here. I have a silver, gold, and rose gold. My rose gold on my desk. My 2 silvers on here because I was using it. So.
Check your head out, okay? We're gonna put an IV line in you, okay? We're gonna give you a little bit of pain medicine so they can take care of your leg, all right?
Come on, move your toes.
What about your toes?
Wiggle your toes. The other one. Come on, the other one.
If Damien can't feel his toes, there's little chance surgeons can save his leg.
Okay. So let's do it. So.
It's okay. We'll take care of you, okay?
Damien's older brother, Frank, is in the next bed. The boys arrived alone, with no parent or relative.
Update is all we have are 2 kids and 1 adult. The 1 adult's here now. Seems to have not been under rubber. So that's the max patient.
This is what Alibaba looks like. This is the app you also can go on the web.
Okay.
So let's get started.
I'm Dr. Olson. How you doing? Having trouble breathing? Just breathe this in, okay?
Ramon Fargas is a chronic asthmatic.
1 to 4 probably, right? That means he's got pretty bad obstructive disease. Have you ever been intubated?
And you also want to see that, right? Let me show you.
4 times? He has a...
It says trade insurance. That's what you want as well. So you want that trade insurance. Maybe if anything was to happen, you will get your money back.
Really quickly. He's having trouble breathing right now. We're going to put him on a machine that's going to help him breathe and open up his lungs a little bit.
See, this is what I look for right here. See, they verify, they have 100%, all that, right? And they say how many transactions they have in response within 2 hours.
When they can't keep up with their own breathing, we have to put them on a ventilator. We have to sedate them.
That's what type of stuff that you need to look for, okay?
Breathe, and they get a lot of other problems associated with that. Infections from the tube, they lose their ability to breathe on their own, they have to go to the ICU for several days, so it's much better if we can avoid doing that.
But Ramon can barely breathe. It's going to be a fight to keep him off the ventilator.
Okay. It's all right, David. David, we're going to take care of you, okay? Listen to my...
The trauma bay is packed with injured patients from the collapsed building. Damien may be going into shock.
All right. It's okay, David. It's okay.
Saving his leg won't be easy.
Ooh, now that is sexy.
This child behind me has a laceration through his head, and he has a amputation of his lower extremity. We're going to try and send him to someplace where they could possibly reattach, but we're not too sure. It seems like all nerves are cut, all sensation is lost. Things don't look too well. He's drinking his gastrograph now to go up for CAT scan, and we're working on trying to get family. Okay?
out and make sure you talk to your vendors and get
I'm
samples.
being brought here.
So that's another thing I want to do.
I'm making the contacts to Claudia so you can do the medical care. And we'll get it.
All right.
20 minutes later, Ramon is still struggling to breathe.
Are you feeling better? That's because you're working hard to breathe. I don't want to have to intubate you, but you're not looking like you're getting too much better. You're going to be okay. Just keep breathing, okay? We're leaning a little bit more towards possibly having to intubate him. I just asked him, and he doesn't want to do it. And I can't really do it if he's awake and alert and conscious. I can't really do it without his permission. But I'd like to do it sooner rather than later before he gets too bad.
In the St. Barnabas ER, Dr. Olson can't stabilize Ramon's breathing. He suspects this could be worse than he thought.
Do you have congestive heart failure at all? Have you ever taken Lasix or anything like that? Never had a heart attack, nothing like that? I'm sorry, I don't want to intubate you, but I want to make sure your blood's okay. You're looking a little drowsy to me. You look like you're tiring out a little bit.
Ramon's EKG contains more bad news.
Oopa. Did you send a plus on him? His K is high. His cardiogram is definitely abnormal. That cardiogram would be associated with somebody that's had some sort of heart problem in the past. Now, we know he has some high blood pressure. I'm not really sure what other heart problems he has, but it's kind of a nasty-looking cardiogram for a guy that's only 42 years of age. So we're going to see if we have an old one in the computer, which we should because he's been here a bunch. We can compare it. If there's no change from his old cardiogram, it's a little bit less worrisome. But if he's got an acute change, then we're a little bit worried about that. This could just maybe be a little bit more than asthma.
Damien is rushed upstairs for a CT scan. He also could have suffered serious internal injuries when the building collapsed on top of him.
So this is the CT of our young boy. There's no evidence of any intracranial bleed or fracture.
What are we worried about his pelvis as well, too?
Pelvis looks stable on the X-ray.
Looks stable on the
I don't see any evidence of fracture.
His father, Frank, is now with him in the hospital. The policeman who rescued Damien stops by to see how he's doing.
Damien, you take care, okay?
The policeman.
Remember me, right? Huh? Remember me holding my hand? Then you take care of yourself, all right? I'll see you out there, right? Good.
It's a little bit disheartening to see that the child might lose his life. But hopefully, you know, we'll see what they can do. He's lucky in a lot of terms. There could have been a lot more potential bad injuries. He's going to have a lot to overcome, and you know, he's got good family support, so hopefully he'll be strong enough to overcome them.
Surgeons at a pediatric hospital will try to reattach Damien's leg. Back in the ER, there's good news about Ramon's asthma attack.
It looks like the old cardiogram looks exactly like the new cardiogram, so there's been no change. So that's a little bit reassuring that whatever he came in with is not any different than what he had on the previous visit. So it's probably just a severe asthma attack at this point. But we're going to look at his chest x-ray, and we're going to keep a close eye on him to see how he does.
But the chest x-ray shows Dr. Olson's suspicions were correct.
He's got a pneumonia, a gnarly looking pneumonia. And he's got cephalization too. It looks like he may have a little bit of component failure. It looks like you have a pneumonia on the right side of your chest. Okay, in addition to the asthma symptoms that you're having. Deep breath.
Okay, good.
He's sounding a lot better than when he came in. He looks a lot more comfortable than when he came in. So we're going to admit him to probably a monitor setting, probably telemetry or ICU, just to keep an eye on him overnight, make sure he continues to get better.
When I say talk to them, I mean talk to them. So that's one of the ones I find a good enough vendor.
In the trauma bay, Dr. John Zambito treats a victim attacked in a suspected gang initiation.
That's where my finger is, you can see. Did you see the size of the knife? Okay. So it's a 20-year-old female, sustained isolated stab wound to her right lower back. It seems low enough where it's not involving the lungs, but you're worried about injury into the abdominal cavity.
So usually at night I try to talk to vendors and stuff like that because it's morning for them and night for us. So usually this is why I be up so late. I be talking to my vendors and looking for more vendors, like my kid vendors. I have my adult vendors and stuff like that. I have a men's clothes vendor that I be talking to because I like their clothes. So I'm just looking for a kid vendor, honestly. I feel like that's what I'm struggling on finding. And like I said, I do have some I'm struggling to find them on Alibaba. I did find I think 3 on Alibaba that I'm willing to give a try to. So I'll let y'all know about that.
I can't call the shots for this trauma. Alright?
ER Dr. Olson.
And I'm going to go ahead and text this vendor, and I'm going to tell y'all what y'all supposed to be saying when texting the vendor.
Some lacerations or scoriations of his lower head. Apparently he's no good reserve. So, he has not been verbal with me. I don't know if it's more so because he's just not cooperative versus... There you go. This is a possible PCP.
PCP is actually dissociative type of drug. Your brain, your body sort of feel dissociated and disconnected. And it has some anesthetic properties. It would account for his mental status, but we have to assume that there may be something else going on. He had a headache, so that has to be kind of a diagnosis of exclusion.
I hate when they do that. They try to fucking correct me. Like, don't correct me. Y'all like when you be talking to somebody and then your phone want to sit there and correct you. Like, don't do that. I said what I said. I type what I type. I think I need to turn off that auto-correct stupid stuff.
We're going to do probably head, neck, chest, abdomen.
So, I want to say...
In the Subarnabas trauma bay, doctors believe Ralph Pacheco is likely to be behind the injuries. His body badly broken from the fall.
So we can't really tell us what's going on, and we're going to have to almost x-ray everything on him that doesn't look right to pick up his injuries, and we don't want to miss any important ones. The real big ones are the head, the chest, and the belly. If he's bleeding, either one of those 3 places it probably needs to be addressed very, very quickly. The rest of the stuff like the fractures and all that, while it's painful and they need to be addressed, they don't need to be addressed within a matter of minutes.
His scans revealed their suspicions were correct.
Ooh, that's not good at all. It takes a lot of force to break a lumbar vertebra, man.
And he's got a fracture right there. He's got a compression fracture. He got pushed over.
So, and I will just wait.
He's got a calcaneus.
And then I will talk to multiple vendors. Like, it's good to have a backup vendor for whatever reason or case something may happen. You have a backup vendor.
This bone, which is here, is supposed to be here, and it was pushed back here. Consistent with maybe somebody falling from height on their hand, hitting their hand, and pushing that bone up further in the wrist.
Pacheco is on his way for a CT scan when his father arrives.
Does he have any kind of outside injuries or just...
He's got a broken wrist, a broken heel bone, and a broken spine so far. It looks like he either jumped or was pushed or fell off a tall object, like a building or something like that. He's going up to CAT scan, getting a CAT scan of his head, his neck, his chest, and his belly.
I'll be back, y'all.
To see whether they're in a significant amount of force. He's very lucky to be alive, definitely.
So, basically, what I do is continue to look. Honestly, just continue.
Man.
John Zambito knows his next patient well.
How you doing, alright? So what you guys say?
Juan Carabello is 73. He can't breathe because he's got water in his lungs.
Feeling better? Alright, I
Okay,
got this.
here
What
we
do you got
go.
here? Something good for me.
Oh, I'll take both of them. So I'm take both of these vendors. I should just.
Why are you always here? Good food, right? Comes to see me. No, he's got a history of congestive heart failure. He's got coronary artery disease. He's a pacemaker. What else we got? Asthma? COPD? Which one? Emphysema? Diabetes? Smoking? This is what you really need. Yeah, I know. But you're feeling better, right?
Well, I sell jewelry for men and women and kids. I also sell hair growth oil, lip oils, lip scrubs.
Hang in there. Just keep breathing. We'll talk later.
Hair growth oils. Hair growth oils. Lip oils. Lip scrubs.
Where'd you find them? In the home?
Bath bombs.
Hey kiddo. Hi, how are you? My name is Dr. Zabo. You know what happened to you?
And I'm going to be selling plus size clothing,
Gavin Jackson collapsed in his home.
as well as
knocking out
men's
3
clothing
teeth.
and kids'
Zabo
clothing
needs to know
coming
why.
soon.
What's the last thing you remember? Falling on the when you're standing at the time?
I was trying to continue.
Okay. Do you know what you hit your face on? You get a blankie? No? Open your mouth.
Guys, you gonna be okay?
Yep, okay.
Alright, let me go talk to family, alright? Did he do anything at home? Was he wrestling around with any other children at home?
No, it was just one. It was just him. And
Just him?
Yeah.
Okay, and all of a sudden you heard a thump on the floor, or what exactly happened?
I heard about the breathing under my door because my bedroom door was open. So I got up and then I got a little blood on his stomach.
Okay.
And he was trying to get up, but his head kept going back and forth.
Okay. Did you see any type of seizure activity where his arms were kind of moving?
Yes, his arms was like that and his head kept going back and forth.
Any foaming from the mouth?
Yes.
Right there? And his eyes were rolling?
Was it able to be driven?
Alright, y'all. I'm back. So let me see. So basically, you was just gonna say something nice.
Okay.
So there's a pretty significant, mechanism of injury there we call. You are going to feel much worse tomorrow than you do today. But the EKG that we did for your heart looks totally normal. You're not having any evidence that your heart is in any kind of distress. So that's good news. All right.
The test results are negative. Judy and her daughter are cleared to go home.
It's alright, it's not as bad as you think. Her husband was just sent to Senegal, Africa today for the Marines. So I came to stay with her, spend some time with her while he was gone. It wasn't your fault. I didn't have anything to do with it. Your only fault is maybe you should be going faster. Thanks.
Yeah, like I said, I like to just be nice, like just say hi. I'm interested in your
Fall victim Ralph Pacheco will be at risk.
like you can even send in the center acquiring. So
basically, he's
you can like literally send an inquiry. It's right here.
non-weight-bearing status for a minimum of 12 weeks. So patients who are in that
Let me show you
situation,
this one.
because they are at such
So
a
right there where it says send a inquiry, you click that and it will send one for you, and you can just say, hi, I'm really interested in this outfit, and then make sure you look at all the colors that they have, and you say, I want it in, like, you know what I'm saying, ask for something. Some vendors don't have that option, because if you look, some have the option where you can like click to get a sample, and if they don't have it, you need to talk to them and say, hey, do you offer samples? How can I get a sample? Ask them how can you, get in a sample.
it.
So.
Alright? You'll just feel a little pinch in the burn at the groin, and then you'll feel some.
Now, before I write each brand down, these are just the sizes that I need.
This is very straightforward. It's just as bad as putting in an IV. How hard you jump?
So, you want to know what sizes you willing to go up in kids?
That's bad if you don't know. Jump from nowhere. Oh, did you just, you fell? You fell? Well, you don't even know what happened. I don't know why. Oh, man. All right, Ralph, you're going to feel a little pinch and burn. Are you ready? Let's get into the vein. That's his vein. That's right. Forward return. And wire goes straight in. We're going to watch it and do the x-rays. And there's the wire going up. Low pressure here, Ralph. So now I'm pushing that catheter in. You can see that there are two radiopaque bands, two little markers on the catheter, here and here. And that's where we're going to slide the filter in between those two markers. So now we're actually going to just maneuver it between those two marks and let it expand. And you can see, it sort of looks like an umbrella. And any blood clot that's going to come up this way, that catheter.
So,
well done. Not too bad, right? You don't want anybody to have blood clots, but he's a big setup for blood clots right now because of all of the injuries in his legs and the fact that he's going to be lying on his back. So this is the smart thing to do. Once he's up and walking around, we can actually go in from his neck, go down with a special grabbing device, and pull it out.
Another victim of a straight attack. EMS brings in a man shot 3 times.
Yeah, wait.
Gross, does he hit once in the back too or not?
You guys got scissors? Yeah, Ronnie. Through and through with 18. He's got evisceration. He's got one here, right thigh. Get large bore IV in him. It's really cool. Good pressure. So he's a young man. He's got multiple gunshot wounds. He's got one to the right thigh here. One right hip. One suprapubic. Okay? He looks to be shot. One in the leg that looks like it went through. There's one in his hip, which I think is still there. And it looks to be 3 times, 3 separate times. So what we actually have to do is he's got wounds where he's able to bleed. I mean, his leg wound, you worry about a lot of bleeding in there. You're absolutely worried about internal bleeding because he looks like he got shot right in his mid-abdomen. So he needs lots of IV fluids. He's probably going to need bloods. He's going to need IV antibiotics. Just look at that.
In the St. Barnabas ER, Dr. Zambito and the trauma team try to stabilize a patient with multiple gunshot wounds.
How's he doing? Is he poking up there? He's really cool. I don't think he'll pulse his man. Now, what's his pressure? Do we have another one? You got any morphine?
One bullet passed dangerously close to his abdomen. They fear massive internal bleeding.
Dangerous, man.
Is
That may be an exit of his leg. That looks exit.
Only then, once I feel like they have my sizes, I would write that man down as a
You see 2
protector.
bullet holes, one in his front of his abdomen, one
Because these are the vendors, because I need them to have my sizes. 806 will be writing them down if they don't have my sizing that I want. So, keep that in mind. That's why I'm not inviting you. I'm just texting them to make sure if they have those sizes that I am currently looking for. So basically, I will go in and I will continue to put that because I really want to know if they have those
This is a
sizes.
picture of his right leg. Again, just looking for any kind of bullet fragments. We don't see anything. He was lucky where it was low enough, where major vessels and bleeding inside should be minimal. But anytime you got a bullet in your belly, it's just he's rushed to the emergency room. He needs emergency surgery. You know, that's for me the attraction to the ER.
everything is it's here, it's crazy, it's high stress, high
And
adrenaline rush.
you don't want to order too much if you first starting out. Order small because you never know how it's going to sell. So don't go here and be like, oh, I'm gonna order like 500. Like don't do that.
And that's was a perfect example of that.
Ladoska Rogers comes
And
into
it is
the
so
art
hard
when
because
Dean Olsen
China
says
have a different sizes
So
in
what
the
happens
US.
when
Like
you know when the spider
it's
bite
something,
actually
okay?
occurred?
So
So it got progressively worse, and then today it got so bad you went to the ophthalmologist, right? Mm-hmm.
He looked at it and he said that not only was I bitten by the spider, but it also left larvae in my eye.
Okay.
And he lifted the eyeball up, he scraped the larvae out, and told me it was infected.
Okay.
And that was about it.
It's just I need you to lift the glasses up for 1 sec. And I'm trying not to hurt you, but let me just feel it. So will this hurt you?
Yeah, oh yeah.
Okay.
Especially over the eye.
Does that hurt you a lot? Does that hurt you up there? Right about here? In there? Okay. So you can put the glasses back on. Does that hurt you to look in the light? It does hurt you to look in the light. So what I'm concerned about is that you may have an infection in that eye, okay? What's called an orbital cellulitis, which can be pretty nasty. We're going to get you a CAT scan to start off with, okay?
So have you ever had a case like this before?
Never one where there was a spider bite actually in the eye, and certainly not where the spider may have, you know, hatched larvae or left a deposit in the eye. I've never even heard of that before. But I am very concerned about it, that she may have what's called an orbital cellulitis. The orbit is the part of the skull that the eyeball sits in. And if you have an infection there, it's very close to the brain. And we worry about that infection actually spreading into the brain. And that's why these need to be treated very seriously. I'm going to get her a CAT scan and see if we can figure out exactly what's going on and why she's in so much pain.
So
John Zambito sees patients like Boris Irizarry all too often. He's having an acute asthma attack.
okay, so
EMS gets to him and they said he was really, they call it tripoding, where he's probably sitting up kind of on his hunched over. And you see it in sports all the time where people just, you hunch over and that kind of opens up your lungs a little bit more, gives you a little bit more of a capacity to get air in. And when you hear that people are tripoding, that's bad.
Zambito thinks the attack was triggered by high stress after an argument with his teenage daughter.
His body happens is one that you would suspect that he's been on chronic steroid therapy. You found the it's got a very thick neck as well. It has some sleep apnea issues as well. Any CPAP or BiPAP at night?
Sir, at nighttime, do you wear a special mask that forces air into your lungs?
No.
No? Does your pulmonologist think you have sleep apnea?
Yeah, that's what they say.
Sleep apnea is basically where you have episodes while you sleep that you just stop breathing. They basically told us he sleeps in a recliner and a lazy boy. And that's usually a sign of people who have heart failure. They can't lie flat because they feel like they're going to drown. They always have some kind of fluid on their lungs.
I'll be back, y'all. I'm in the home.
Angel, who admitted he was with Vladimir. Vladimir led detectives to a second suspect.
Sorry. Okay. So. I was working. I still haven't found I still haven't found what I'm looking for. So I'm going to officially take a break, you guys, from what time? I'm young. Did I make y'all young too? But I'm gonna take a break from looking for kids' clothes right now. Still have yet to receive. I'm gonna go on my list and grab one of them, but not now. I'm super tired from looking at that. So I'm finna go make some bell bombs. So I'll see y'all in the next video, which will be right after this one, which will be how I make my bell bombs. And then y'all will come with me to make face masks and so much more. So peace, love, and happiness. Like, comment, and subscribe. So follow me on all my social media, which will be linked down below, as well as my website. And as always, if you like some, buy some. Peace.